Hello, everyone. My name is Dr. Borbon. I'm the founder and director of Studio Borbon in Milano. So this is our contact if you want to follow us. My mail, if you have further questions, if you want to write me, I'll be happy to answer. If you want, you can take pictures. I don't care. You just credit us. I have no disclosure. So the presentation today is about lip remodeling. Where do we start to avoid the dark effect? So not natural effect, because every day when I check on Instagram and I check online, I see like the lips injection are always advertised as the natural. I see claims advertising, they say natural results, but those are a few screenshots that I took in the past weeks when I was preparing this presentation, and those are not exactly harmony. This was an advertising on Instagram, masterclass technique on like crazy, strange things. There is this new trend on bandage, which is pretty weird. Like lips that are. This is an Italian advertising, Italian clinic that say the lips a little bit more natural, a little bit more volume, but always in harmony. I don't see much harmony around here, and so a lot of different results that are advertised as natural, but are not at all. So let's start with the case. This is a patient that I treated 1 year ago. She arrived, a really beautiful face, a young patient with a really elegant face that arrived to my clinic, and she was injected previously in another clinic with 2 sessions of really thick hyaluronic fillers in 1 year. So we will see how I treated her later, but where do we see the problem here? So we see that there is a filler migration. Of course, there is a filler migration in the philtrum with a hyperprojection of the filter that causes a discoloration of the mucosa that you can see on the lateral part of the lips, a distortion on the vermilion border, a muscular dysfunction. So I'm sorry that I don't have a video, but those patients, when they smile, they have a big functional alteration and an elongated philtrum, which is a sign of aging. In that case, of course, it's created by the doctor, not by the patient itself, because she's young. So you can see in the frontal view is the same, migration and discoloration and distortion. So where the problem? I think that sometimes we put too much creativity into lips injection. This is an advertising from Nike made from an artist. His name is Tom Sachs, a really good artist. And he was called by Nike to design a really nice pair of shoes. And he said like that sometimes too much creativity is totally useless. So where do we start to avoid the duck effect? I said start from the anatomy, as we are doctors. Is the most easy thing that we can call is the anatomy. So the first really important thing is to understand the role of vermilion. The vermilion is where do we have to inject? In the semi-mucosa, so in the dry vermilion, is the safest and the most effective anatomy part where we have to inject. So we have to stay below the mucocutaneous transition line, because in this case we have spread, and of course not in the wet vermilion. In this case we have migration and accumulation of product. So staying in that part is always efficient, is always a good plane where to inject. Really important, in my opinion, is to understand the difference between subfacial and subnasal lip. We can think about the lip as a lamp which is suspended from a ceiling, and this ceiling is this mass. We have this mass only on the part which is the white in the slide. And there is a good suspension because this mass, it's a really strong structure. And we can put filler there, creating an eversion of the lips with good results, but not on the lateral part of the lips. I never inject the corner of the lip, because in that case you don't have support, and the much you inject, the less you will see an eversion, and it goes down, which is the opposite of what we want. We want to avert, we want to give elevation. In the corner of the lip, you will never have elevation, and the more you inject, the more it goes down. So if you have surgical skills, a really nice procedure is the corner lip, So in this picture has been made also a subnasal lip lift, but the corner lip is really easy. The scar is beautiful, and it's really easy to perform. If you have like a really basic surgical skills, you can do it, and it's really nice. If you're interested, you can check the work of my friend Ben Talley in Beverly Hills. Even if you don't do surgery, those two articles are so important. It's a Bible for the lips injection. It's a Bible for the lip anatomy. And Ben is an excellent surgeon, so follow him. He's a friend, and it's a really good one. So, do's and don'ts. I personally design every single patient. Doesn't matter how many patients you see in a day. If you inject a lot, it's nice to take a few minutes to delimitate the part where you inject subnasal, subfacial lips. I think it's really nice also for the patient, so that you demonstrate that you have a project and it's nice, and in fact you have a project. And stay in the vermilion body, in the dry vermilion, always. Respecting the limitation of the subfacial lip and using a small amount of material. Maybe you can repeat it, but always using no more than 1 ml of HA with medium-low density fillers. Never high density filler, never too thick. And setting like the timing of the injection, so how many injections you do on a patient, on a personalized base, depending on the needs of the patient. So never, of course, overinflate and overinject. It sounds cheesy, but it's not so banal to say. And do not inject too fast. I'm really slow when I inject. When I plunge the syringe, it's really slow, and it avoids a lot of complication. Avoiding the vermilion border, which is another trend. I see a lot of results that are injecting the vermilion border. In that case, you don't have a barrier, so it goes up, and it goes up into the philtrum always, and it overprojects. And understanding these things, avoiding top-down technique, of course. This is another trend that I don't like. There is no anatomical view on injecting top-down, like Russian lips, tenting, Michelangelo lips, and all those things. There is no way to injecting top-down. If you inject top-down, you create a tunnel, and the filler goes up, always. And then you cross 19 degrees the labial artery, so the amount of complication are so high that there is no reason to use these techniques, really. And understanding the migration and spread, so the difference between the migration of product and the spread could be really interesting. I, again, remind you to the work of Ben Talley. So this is the patient that we've seen before. I only treated the philtrum with a few units of Yalase, of hyaluronidase, bicarbonate and lidocaine with a fanning technique. So I enter in the lateral part of the lips and with a cannula, and I dissolved only the philtrum, not the lips. And you can see how it's much more natural. The look is much more younger, and you can have a better dynamic phase. So when she smiles, again, I'm so sorry that I don't have the video, but when the dynamic phase of the migration of thick filler is always disaster, because the smiling process, it's too thick, so they cannot move properly. So a few cases obtained only injected the subnasal lip on the dry vermilion. You can have a good version without making the corner too heavy, that it goes down and creates, even on younger patients, the marionette folds created by the injection, of course, not by the aging. She's really young. Different patient, different age, always injecting a little bit more of the product in that case, with a different rheology, but you can have nice aversion without having any migration of the filler in that case. She was a good candidate for the corner lip. She didn't want to do surgery, she was really young, but you can see how the corner of the lip is pretty heavy, and it tends to go down. So I just injected exactly the part under the nose, creating good aversion. Maybe in the future she can do a little corner lip, which is a beautiful surgical technique. Different HA, because different patient with the few volume on the lips, but a really nice draw of the philtrum and the vermilion border. Again, only injection in the in the middle lips, and with 1.5 cc in 2 sessions. Men's, same. The men's have more strongest mass, so you can add more volume and giving more aversion if you want. But at the same time, the subfacial part of the lip is less supported, so it tends to go more down than women's. Same, and this is interesting in patients that have a really flat maxillary angle. In that case, we can use voluma or more a thick kind of filler to do injection on the nasolabial fold, not for the wrinkles, who cares, but just to give more projection of the really flat maxillary bone. And then after 2 weeks, giving a lip remodeling with less volumization HA fillers. An Afro-American patient with an asymmetric and gummy smile treated with 2 sessions of 1 cc of medium cohesity and a few units of Botox on the levator of the lips. And it's really nice when you treat the subnasal lips having with an asymmetrical smile like this. This was obtained only with fillers, not with Botox. You can have a really nice and balanced result, just understanding the anatomy and not putting too much creativity into doing lip eversion, lip lift, or weird technique with no anatomical base. Thank you so much.